Hi, my name is Kate Trieschman. I'm a fourth year, and before coming to Penn Dental, I did my undergrad at Franklin and Marshall College, and I worked at the FDA for 2 years. There's so much to learn about dentistry with the community sites and so much about how you can help different populations, but one thing that I thought was really interesting and didn't know I was going to learn before going into the community sites was how to run a dental practice. Because in the community sites, we are the assistants, we're helping schedule, and most importantly, we're running all the instruments. So I learned how to use a Statum and an autoclave, which I don't know that I would have had exposure to that without going to the community sites. So my favorite site definitely was going to Puentes. Part of that is Miss Garcia because she makes every day really enthusiastic, starts with a huddle, but also the patient population that you get to work with is a lot of Spanish-speaking immigrants who maybe haven't seen a dentist in several years. They're some of the most kind, incredible patients I've ever worked with. And they're so willing to teach you some dental Spanish. And it was also really, really good experience to understand how to work with the translator on the iPad and still be able to effectively communicate with the patients. So the translator is up on the iPad, and then we have it in the corner of the operatory, and there's video and audio so they can see us, patient can see the translator, and we can all sort of be part of the conversation. So one patient that I remember really clearly from Puentes, I had seen her for a few appointments, and we had gotten through her cleaning. She was only 15 years old, but she had some caries in her anterior teeth that you could see. So when we finally got to do those restorations, she was so cute. She kept holding up the mirror. She was so happy and thankful. I just thought that was really impactful that such a small thing could make a huge difference on a 15-year-old's perception of herself. I think for me, the community sites will impact my career significantly because I'm in the MPH dual degree program here. So one thing that I want to be able to do is much like Dr. Glutch, who's a huge role model of mine, I want to be able to go into a community, speak with stakeholders, determine what their dental needs are, and then somehow create a community site that can provide dental care and address the needs of that specific community. So being able to go into this setting and actually have hands-on experience in sites that have been set up in a very systematic and organized way with community buy-in was really, really meaningful to me and something I'll take forward for sure. So I think it's important to note that at the community sites, we still follow all the same standards of care at the school, but we are able to move care along a little bit more quickly because we have a smaller faculty to student ratio. There's also always an assistant student and a provider student, so you can operate, not that we're working faster so that we don't achieve good clinical results, but you're just working more efficiently because you have someone to hand you your instruments. You can turn over the chair a little bit more quickly. You're not waiting for faculty. So I think that's really important for some of these communities where people have limited time to take off from work and they can't necessarily afford to sit in the dental chair at the dental school for 4 hours, but they can accomplish the same thing in a much shorter appointment at these community sites. So I was really excited for the community site programs at the beginning of my third year, and I think they really shaped a lot of my experience in clinic, and I think it was just, I guess, one of my favorite things that I've done, and that sounds small, but it really did have a meaningful impact and something that I think a lot of students benefit from seeing how they can make a difference in their community, even though they might be planning to go into private practice or specialize or work in academia. There's always a way that you can, connect with stakeholders in a community itself. I think the best advice is to understand that the patients at the community sites are a different population than who we see at the dental school, but your approach is the same in that when the person first gets into your chair, you're always going to ask what their goals are and make sure that you're addressing their needs first and foremost, and understanding that it is going to be different than the dental school, but the faculty are very familiar with the sites and they're very comfortable going in, so you can also rely on them.